Hello everyone, today I'm here to show you exercises for sciatica. So first let's understand what is sciatica. Sciatica is a compression of the sciatic nerve which starts from the lower back, around the bottom, into the groin area and down the back of the leg, all the way down to your foot. So there are chances of this nerve to get compressed at different levels. And when the nerve is getting compressed, you might feel the signs and symptoms of tingling, numbness, burning in a part or throughout the course of the nerve. How to address this issue? So the first technique is decompression. Decompression is decreasing the compression on the nerves and thereby relieve the symptoms. Number 2 is stretching the nerve and the muscles, which contributes to the compression. And number 3 is to improve the posture, correct the muscle imbalance so that this doesn't happen again. So let's start with the exercise.
See traction machines in the therapy gym. This technique works similar to the traction machines. It helps to increase the space between the vertebrae and thereby decreases the compression on the sciatic nerve. So in order to do this, you need a small box like this. You can also use 2 or 3 pillows such that you achieve 90-degree hip knee flexion when laying on your back and with your hips and knees flexed as seen here. The other thing you can use is the therapy ball. You can place it underneath as you see the box here. And you can relax in this position for about 5 to 10 minutes. Increase the time slowly as your tolerance to the technique increases. I use this very frequently with my patients and the results are really great. Once you're comfortable in this position, you can try some exercises also, like pulling the knee towards the chest. You can alternate the sides and do about 10 times on each side. Start with lesser number of repetitions and increase the reps as your tolerance gets better.
Then comes stretching of the sciatic nerve itself. You can do it either laying on your back or in seated position. I'm going to show you both techniques. You would have heard about the nerve floss technique. So first we are going to stretch the nerve on one end. For that, move your foot up towards your face and then move it down. Then lift your head up to look at your belly and let it relax. Again, move your foot up towards your face, bring it down, then move your head up to look at your belly and relax. So when you're doing this exercise, you shouldn't be feeling any pain, but there should be stretching sensation on your leg and the back of your. This exercise is by stretching both ends together. So for that, you move the foot and the head up together towards each other and then let both ends relax. Again, move the foot and the head together up, then let both ends relax. You can do about 5 to 10 times and increase the repetition as your tolerance to the technique increases. Another way to progress is by adding the knee component. So for that, you straighten the knee and bend it. Then lift your head up and relax. Again, straighten your knee and bend it. Then lift your head up and relax. And the progression is moving the leg and the head at the same time. Try this technique once you're comfortable moving the foot and the head together without feeling any discomfort or pain. This is how we do the nerve floss technique in sitting. Come closer to the edge of a chair and then straighten your knees such that your heel stays on the floor. Then move your foot up towards your face and bring it down. Then you move your head down towards your chest. Then bring it. Again, move your foot up towards your face. Move it down slowly. Then bend your head towards your chest and move it up. Repeat about 5 to 10 times. Increase the repetitions as your tolerance increases to the activity. And then you can progress this exercise by moving both ends together. So that's when you're stretching the nerves at both ends. So you're moving the foot up and your head down together at the same time. And relax them. Move your foot and your head down together at the same time. And relax. Now when this exercise is completely pain-free, there is no discomfort at any ends, you can progress by adding the knee component. So you straighten the knee and relax. Then move your head down and up. Straighten your knee, relax, move your head down and up. You can progress by stretching the nerve from both ends by moving both components towards each other. So the knee goes up and the head goes down. They are moving towards each other. And relax. Again. And relax. Next comes the stretching of the tight muscle groups that would be a contributing factor for sciatica.
So let's do the hamstring stretch. Bend your knee, move your leg up towards your chest, and then straighten your knee slowly up towards the ceiling until you feel a nice stretch at the back of your thigh. Hold the stretch for about 15 to 20 seconds. And then move your knee down, relax your leg, and then repeat it again. You can do about 3 times on each side. To get familiar with other hamstring stretching techniques, you can watch my YouTube video on hamstring self-stretch. It demonstrates 4 different techniques that you can try and appropriate for all ages. Then let's stretch the piriformis muscle. Around the groin area is where the sciatic nerve gets compressed commonly between the 2 flaps of the piriformis muscle. In order to stretch that muscle, you bend your knee and then cross your hip. Put your foot flat on the opposite side and then push your knee down towards the floor. When you do that, you will feel a stretch around your hip area and at the side of your upper thigh. Hold the stretch for about 15 to 20 seconds and then relax. You can repeat about 3 times. The exercises that are helpful in sciatica are mainly the flexion-based exercises. So you bend your knees, put your feet flat on the floor, then pull one knee towards the chest and bring it down. Pull the other knee towards the chest and bring it down. You can do about 10 times on each side. And then if there is no pain or discomfort, you can try pulling both knees together towards the chest and relax. Pull both knees together towards the chest and relax. Next is turning to the side. Turn as much as you can from the lower back until you feel pulling at the side of your hips and then come back to the starting position. Repeat about 10 times on each side. Now remember, we did this exercises with the positioning technique, but the angle is different in that. If it's harder for you to do them on the ball, you can do them like this, laying flat on your back. The next one is straight leg raises. So you bend one knee and then lift your opposite leg straight up towards the ceiling and bring it down. Repeat about 10 times. Now, bending the opposite knee is very important to stabilize the back. You will feel more strain on your lower back if you try this exercise with the opposite knee straight. As you start feeling better, you can add gentle core strengthening exercises.